Hello, I'm Miguel Gomez with HIV.gov at the Synchronicity Conference just outside Washington, D.C. I am so lucky to be with two of my colleagues from the office in which I work, and it's great to spend time with my colleagues. And I'm going to ask them a few questions about this conference and some broader issues. But first, I'm going to turn to Jessica Deerin, who just minutes ago finished closing out today's first plenary session. Now, Jessica, you did an excellent job. It was so good to hear you. You shared information on Hep C. What were the takeaways from your presentation?
Yeah, so I shared the state of hepatitis C. So our office developed and led coordination of the Viral Hepatitis National Strategic Plan with the ultimate goal of elimination by 2030. So I shared some of the barriers that our country faces in reaching our elimination goals through the hepatitis C clearance cascade. So we still need to improve access to screening and treatment in settings where people who are more vulnerable to hepatitis C go. We need to improve linkage to care. When someone is identified as positive, they need to find a place to get treatment and care. And then we also need to increase access to treatment medication. There are still restrictions in place, Medicaid restrictions for getting access to those treatments, including pre-authorization and sobriety and prescriber restrictions. So we have to overcome those barriers through various ways. I shared information on new point-of-care diagnostics.
You certainly did. That was great to hear.
So hopefully that's coming to be available in the next couple of months. And I also shared information about the President's hepatitis C elimination program. So Dr. Collins is leading that initiative and is really excited about the opportunity for that to become available this year.
I know, fingers crossed. That's such wonderful good news. Now, I'm going to ask you to pass the mic to Darcy, who also is part of the hepatitis team, but which we're really lucky, also works on the topics of syndemics. I mean, this whole conference here, Synchronicity, it's about the intersectionality of HIV, STIs, you just talked about Hep C, harm reduction, equity, and I think I'm missing one of the other items, but it's about taking a holistic approach. Now, Darcy, our office, after 2 years of work, has actually defined the term syndemic. Would you mind sharing with those watching that definition?
Absolutely. So, as Miguel said, our office and HHS just came out with an official definition, so I'm going to read it so that I don't make a mistake. A syndemic is when two or more diseases or health conditions cluster and interact within a population because of social and structural factors and inequities, leading to an excess burden of disease and continuing health disparities. And so an example of this is our office recognizes that HIV, viral hepatitis, and STIs all have similar drivers and impact some of the same populations.
Yes. And I really appreciate you talking about how important that is. So also, I encourage everyone to visit HIV.gov because one of our other colleagues, Nate Fessick, who's going to present at the closing plenary, helped do a wonderful blog providing everyone that definition and providing additional information on syndemics. Now, don't give the mic back yet. I have one more question because I got to see you at the poster session. You were talking to conference participants. What was your poster about?
Yeah, so my poster is looking at how can we increase infectious disease services for HIV, viral hepatitis, and STIs in opioid treatment programs. So an opioid treatment program provides FDA-approved medications to those with opioid use disorders. Those with opioid use disorders are also vulnerable to contracting these infectious diseases. And so why this is important and why a syndemic approach is important is because for many of these people, an opioid treatment program is their only touch point to the healthcare system. And if we can bring these services to them at an opioid treatment program, instead of asking them to go across town to an HIV clinic or to a liver specialist or even a primary care, they're much more likely to be able to utilize these services, and it's been shown that their health outcomes will improve.
Well, and thank you. That's a perfect example of the importance of a syndemic approach, and also, the synchronicity of things, which we heard a lot about throughout the conference. Now, before we close, again, I want to laud you on your plenary session on Hep C. Is there anything else you'd like to share with our viewers before we close?
Yeah, sure. So I'm also participating in a session later today where we will share some preliminary findings from a project where we were addressing and identifying barriers to financing integrated viral hepatitis services into non-traditional and clinical settings. So we'll be talking about some innovative service delivery models,
Great.
Including using Medicaid flexibilities.
Terrific. I am so grateful to be here with these two powerful colleagues who are really making a difference in public health policy. I want to thank you for watching. To learn more, visit HIV.gov. Thank you for your time.